One of the most important things for parents, teachers, early educators to be aware of are the early warning signs, or what are the early symptoms that a child might have an autism spectrum disorder. And remember, when we talk about these, it doesn't mean that a child who has one or two of these features has an autism spectrum disorder. It just means that these are the symptoms you want to be aware of, and if you do see them, then you might want to take a child to be evaluated for a potential autism spectrum disorder. What research has found is that one of the earliest signs that a child might be developing autism is a lack of response to their name by the time they're about 12 months of age. So most babies learn their name very quickly, and they respond by stopping what they're doing and turning and looking at the person who's calling their name. And one of the interesting things that research has found is that when you look at videotapes of children who then later on were diagnosed with autism, when you look at the videotapes of their first birthdays, that's an opportunity where everybody's calling the baby's name. Look over here, you know, Johnny, look, Johnny, take the picture. Ooh, Johnny, look at your cake. Ooh, Johnny, give grandma a kiss, look at grandma. And what they found is that children with autism tended not to orient to their names. It's almost as if they didn't realize that that was an important thing to do, and that your name means I want your attention. So lack of response to name, as we talked about in another segment, the lack of joint attention, which is typically developing babies show an interest in wanting to share their interests. So if they see an airplane in the sky, they'll look at it and they'll point at it, and then they look at mom and dad and they look back at the airplane like, don't you see that cool thing up in the sky too? Or what is that cool thing in the sky? And as we said also in the other segment, the other thing that typically developing babies do before 12 months of age is that they look at where their parents are looking. They join their parents' attention. And so if they see mom looking over there, they too will look over there to say, hey, what is mom looking at? The lack of joint attention and joint referencing is really important because children with autism are one of the few groups of children that have actually been shown to consistently not develop joint attention and joint referencing. Oftentimes it's still not in place by the time they're 3 or 4 years old. And this is one of the things that when we do a diagnostic evaluation, we're going to be looking at, is does the child share their attention or join another person's attention? Another thing, of course, a lack of development of language is a key sign, but many children who do not have autism also have a language delay. So just because the child isn't speaking, you know, in single words by 18 months and 2 or 3 word phrases by 24 months of age, that doesn't necessarily mean that they have autism, but it is a warning sign that a child should probably be evaluated. Another thing that we see that's common in children with autism is they don't develop gestures. So social gestures, they don't seem to clap, they don't seem to respond to when they're clapping. So we all know that typically developing babies, once they learn that they can do something and everybody will clap, they want to do it over and over again, and they love to get that social attention of clapping or yay. And we find that young children with autism don't tend to respond to a clapping, and they themselves don't necessarily clap. They might do this behavior, but it's not to say, hey, didn't I just do something really neat? Isn't everybody proud of me? Or I'm proud of myself because I just did something really neat. Lack of a pointing gesture is also another common warning sign. Children with autism tend not to point to the things that they're interested in their environment, and we know that before babies are able to speak, they use that pointing as their primary way to share attention. Look, isn't that really neat? Or what is that over there? Or tell me the name of this picture in this book. And children with autism don't develop that pointing skill. And then you see the behaviors that might be unusual, such as being interested in watching wheels spin. So oftentimes parents report that when being pushed in their stroller that the child enjoyed leaning over and looking down to watch the wheels spin, or they'll take a toy car and turn it over and spin the wheels, or they'll take any toy and spin it and watch it spin. So interest in spinning objects, interest in lights and fans, staring at fans as they're spinning, being more interested, let's say, in an air conditioner unit than toys in a room. Those kind of things are some of the real key warning signs that a child might have an autism spectrum disorder.